Bismillahirrahmanirrahim. Today we are today we are going to study about the intermuscular spaces. Intermuscular spaces, as its name indicate, that it must be between the muscles. In our body, when the muscles are giving original insertion at any place, there are sometimes the spaces left behind, or there is some gap that is present between the muscles, which is termed as intermuscular spaces. Here this is a diagram of a scapular region, and we are going to study about the intermuscular spaces in the scapular region. This is the dorsal surface of scapula. Before going into the deep discussion, you should understand this diagram. This is this scapula, this one is the humerus, this is the scapula, and this is this lateral border. Be remember this thing, this is the lateral border of the scapula, this is the medial border of the humerus, okay, and they are forming the shoulder joint. Here in this diagram you have already studied about that the muscles that are originating from the lateral border of scapula. This is the teres minor muscle, this is the teres major muscle. This diagram is present in the VD, and it's a very easy diagram, and from this diagram you can easily determine all the boundaries and contents of the intermuscular spaces. So we were here that this is the teres major muscle, this is the teres minor muscle. This muscle, this is the long head of tricep brachii, and spans the length of the arm because it is originating from the infraglenoid tubercle of the scapula. Okay, this muscle is coming from the infraglenoid tubercle of the scapula, and it is passes through whole of the arm and inserting in the forearm at the olecranon process of ulna. Okay, so it properly spans the length of the arm. This is the tricep muscle. Once these muscles are originating or inserting, there are some spaces that left behind. You can see here, these are the spaces that left behind. They are termed as intermuscular spaces. So this one is termed as quadrangular space. Why it is called as quadrangular space? Because its shape is quadrangular. Okay, its shape is quadrangular, and just medial to that, we remember this thing, that this side is the medial side, this one is the lateral side. So medial to that is the triangular space, which is termed as upper triangular space because it is in the upper part, and this one is the lower part, so it is called as lower triangular space. So these are the intermuscular spaces. Teres minor crosses, here you can see teres minor crosses posterior aspect of the shoulder joint, okay, and origin of the long head as it passes from the origin of the scapula to the humerus. ठीक है, scapula से humerus की तरफ जा रहा है, it crosses the posterior aspect of the shoulder joint. On the anterior aspect of this teres minor is the subscapularis. You all know that the subscapularis muscle is originating from the subscapular fossa, so it is present on the anterior aspect of the shoulder joint. Teres major, the teres major muscle also crosses the long head, and it runs up to the bicipital groove. So these potential spaces are the intermuscular spaces, and these potential spaces are formed between the lateral border of the scapula and medial sector humerus along with the head of the tricep brachii, okay, and the teres minor and subscapularis and teres major muscles. These are the muscles that are involved in intermuscular spaces. Now first of all is the quadrangular space. You can easily tell us the boundaries when you memorize this diagram. So superiorly कि posterior aspect पर तो inferior border of teres minor है, ठीक है, inferior border of teres minor is lies behind the shoulder joint, so it is forming the superior boundary along with the subscapularis, which is present in front of that. Okay, subscapularis in front and inferior border of teres minor behind, and in between them there is a capsule of shoulder joint. They all forming the superior boundary of the quadrangular space. Inferior boundary किससे बनेगी? Inferior boundary is simply formed by the superior border of teres major. You can see here superior border of teres major. Now the medial and the lateral boundaries. The medial boundary is formed by the lateral border of long head of tricep brachii. Be remember, you have to memorize the diagram. so you can easily tell the boundaries. So the medial boundary is formed by the lateral border of long head of tricep brachii, and the lateral boundary is formed by the surgical neck of humerus. So this is so simple, and the contents that are passing through this quadrangular space is the axillary nerve with the posterior circumflex humeral vessels. Okay, posterior circumflex humeral vessels. This was quadrangular space. Now the upper triangular space. This is the upper triangular space. Simple. The boundaries is the inferior border of teres minor, and inferior boundary is formed by the superior border of teres major. And this is, what is this boundary? This is a lateral boundary. Okay, this lateral boundary is formed by the medial border of long head of tricep brachii. Okay, memorize this diagram. Again, I am telling you this thing. This is the superior boundary, this is the inferior, and this one is the lateral boundary. The upper triangular space gives gives space for the passage of circumflex scapular artery. Okay, the circumflex scapular arteries passes through this. This is the artery that is giving anastomosis with the suprascapular artery and deep branch of transverse cervical artery. Okay. Now the lower triangular space. This is the lower triangular space. You can easily see that it is diagonally opposite of the upper triangular space. ये lower triangular और ये upper triangular, they are diagonally opposite to each other. So the boundaries of this is the medial boundary, this one is the lateral boundary. Okay, and this one is the superior boundary. So superior boundary is formed by the lower border of teres major. Medial boundary is formed by the lateral border of long head of tricep brachii, and medial lateral boundary is formed by the medial border of humerus. So you have to memorize this diagram, and the contents of this intermuscular space is the radial nerve and profunda brachii vessels. You have to memorize simply the names of these vessel and nerve. Radial nerve and profunda brachii vessels passes through the lower triangular space. In the upper triangular space, there are circumflex scapular artery. In quadrangular space, there is axillary nerve along with the posterior circumflex humeral vessels. So this was whole about the intermuscular spaces, their boundaries and their contents. This is so simple. You can easily memorize it by memorizing this diagram, and not confuse the medial and lateral boundary by this. This is the medial side and this one is the lateral side. Okay. The next topic of our discussion is the radial nerve. So this is the diagram I have taken from the KLM. It's given in the KLM, and it's very easy for the understanding the relations of this radial nerve. You all know that the brachial plexus, the posterior cord of the brachial plexus is continuous as the radial nerve. Here you can see this one is the median nerve. ठीक है, median nerve है, और इसके बिल्कुल पीछे से जो जा रही है ना, जो हल्की सी आपको ह्यूमरस के पीछे भी नजर आ रही है, this one is the radial nerve. Okay, the radial nerve is the biggest nerve in the arm. It is supply all the muscles in the posterior compartment of arm as well as forearm. Okay, so this is a very big branch of the one of the branch of the brachial plexus that is coming from the posterior cord of brachial plexus. Okay, you should memorize its relation when it enters into the arm. Okay, the radial nerve enters the arm posterior to brachial artery. Okay, posterior to brachial artery, medial to humerus and anterior to long head of tricep. ठीक है? The relation is that it enters the arm posterior to brachial artery. You can see it passes posterior to brachial artery. यहाँ पर ये this is lies medial to the humerus and then anterior to the long head of tricep brachii. This is the relationship when it enters into the arm. Now it runs downward. ठीक है, and it gives branches to the long and medial head of tricep. Here it gives branches to the long and medial head of tricep. Then it descends infrolaterally. You can see here it passes infrolaterally with the profunda brachii artery and passes around the humeral shaft and enter into the radial groove. ठीक है, here it is there is a radial groove here. The radial nerve descend in the radial groove, and the branch of the radial nerve to the lateral head of tricep arises within the radial groove. Okay, in the radial groove it gives branches to the lateral head of tricep. When it reaches the lateral border of humerus, अब ये यहाँ पर lateral border of humerus पर आ जाएगी, ठीक है. Okay, when it reaches to the lateral border of humerus, just 5 cm below the deltoid tuberosity, it pierces the lateral intermuscular septum. ये intermuscular septum दिखाए हुए हैं. What are intermuscular septum? You will learn about later on that there are some septa that are present between the muscles, and whenever something is going deep in the tissues or coming upward towards the skin, they have to pierce the intermuscular septum. So the at the lateral border of humerus, just 5 cm below the deltoid tuberosity, the radial nerve pierces the lateral intermuscular septum and continues inferiorly in the anterior compartment of arm. ठीक है, एक कंपार्टमेंट से दूसरे कंपार्टमेंट में जाने के लिए इंटरमस्कुलर सेप्टम्स को हमें पियर्स करना पड़ता है. ठीक है, एंड इट कंटिन्यूज inferiorly in the anterior compartment of arm. अब ये anterior compartment of arm में आ जाती है. ठीक है, ये आपने देख लिया, ये बिल्कुल नीचे आ रही है. ठीक है, इट एंटर्स इनटू द एंटीरियर कंपार्टमेंट ऑफ आर्म बिटवीन द ब्रेकियालिस एंड ब्रेकियोरेडियलिस टू द लेवल ऑफ लेटरल एपिकोंडाइल ऑफ ह्यूमरस. यहाँ से दोनों के दरमियान में चली, ये ब्रेकियोरेडियलिस है और ये जो आगे मसल आपको नजर आ रहा है, दिस वन इज द ब्रेकियालिस. ओके, इन दोनों के पास, इस दोनों के दरमियान में एंटर हो जाती है बाय पियर्सिंग द इंटरमस्कुलर सेप्टम. ओके, देन इट रन्स डाउनवर्ड and continues inferiorly in the anterior compartment of arm between the brachialis and brachioradialis at the level of lateral epicondyle of humerus. Here you can see it reaches to the lateral epicondyle of humerus. Okay, it reaches to the lateral. This one is the lateral epicondyle of humerus. Okay, it reaches to the level of lateral epicondyle of humerus and anterior to the lateral epicondyle, the radial nerve divides into, यहीं पर बिल्कुल anteriorly इसके divides into deep and superficial branches. Okay, the deep branch of the radial nerve is entirely muscular, ठीक है, and also it gives articular branches. The superficial branch of radial nerve is entirely cutaneous in its distribution, which we will tell you about later because it gives the sensation to the dorsum of hand and fingers. You will learn about them in hands. Okay, so this was about the radial course of the radial nerve. This is very simple. You can easily memorize that. Muscular branch, some of the muscular branches it gives to the tricep brachii. Okay, now whenever you should memorize the injuries to the radial nerve. What happens when there is an injury to the radial nerve arises? So the injury to the radial nerve, whenever in radial nerve is injured below superior to the region of its branches to tricep brachii. ठीक है, जब भी tricep brachii से ऊपर इसकी होती है ना इंजरी, ये जैसे कि मैंने आपको इस डायग्राम में दिखाया. ठीक है, यहाँ पर ये इसी लेवल पर जो है वो इट गिव्स ब्रांचेस टू दी लॉन्ग हेड एंड लॉन्ग एंड मीडियल हेड. ठीक है, जब भी इससे ऊपर ब्रांचेस से ऊपर इसकी इंजरी हो जाती है बिफोर गिविंग द ब्रांचेस, whole of the muscles are paralyzed. Okay, we remember this thing. Whenever the injury is occur superior to the origin of its branches to the tricep brachii, it results in paralysis of tricep muscle, brachioradialis, supinator, extensor muscles of wrist and fingers. Why? Because they are supplying whole of the extensor compartment of arm as well as forearm. Okay, so whenever the injuries of the radial nerve occur superior to the origin of its branches, it will give complete paralysis of tricep, brachioradialis, supinator and extensor muscles. And there were also loss of sensation in the areas of skin that are supplied by these nerves. But whenever the injury is occur in the radial groove, okay, the tricep is usually not completely paralyzed. Why? Only it is weakened because only the medial head is affected. I have told you already that in the radial groove, it gives branches to the when it reaches it gives branches to the lateral head of the tricep arises within the radial groove. I have told you. So the medial head is given branches. यहाँ पर ये KLM और दूसरी बुक्स में थोड़ा सा वेरिएशन है, ये मैं आपको बता देती हूँ. It's given is that कि जो radial nerve है in this area, in the radial groove area, it is supplying the medial head. It gives some branches. It's given to medial head as well, also with and the also given to the lateral head of the tricep as well. Okay, so whenever the injuries occur in the groove, so the medial head is affected, and because of that the other heads, the long or lateral head, sometimes long head is affected, sometimes lateral head is affected according to the injury in the radial groove. So it is obvious that the complete paralysis will not occur, okay, and only the weakness in the hand is occur, and all of the extensor muscles that are that are injured, so it will causes the wrist drop. We remember this thing, that the whenever is injury is occur in the radial group, the tricep is usually not completely paralyzed but only weakened because the medial head is affected. However, the muscle in the posterior compartment of forearm that are supplied by more distal branches of the nerve are paralyzed. ठीक है, जो different जो इससे भी ज़्यादा distal branches से होंगे वो completely paralyzed हो जाएंगे. और characteristic clinical sign क्या होगा? The radial nerve injury का वो wrist drop होगा. This is the simple. You can see that the clinical sign that this is the wrist drop. ठीक है, inability to extend the wrist at the metacarpophalangeal joints. ठीक है, you can see here that the person is unable to extend his, ठीक है, to extend his hand, because we have already told you that the radial nerve supply the extensor muscles. So here, this once it is got damage, the person is unable to extend his wrist and fingers at the metacarpophalangeal joints. Okay, so this was the injury of the radial nerve. This was whole about the radial nerve as well as intermuscular spaces. Thank you.